Good morning. I'm going to do an oral care. So the first thing, always check the patient's chart, gather the necessary things, and wash your hands before entering the room, and also wash your hands before you begin any procedures. So when I'm ready, I'd always check the patient's ID band, apply the appropriate PPE, such as gloves, mask, goggles if I feel that I need to. So always before you begin and doing anything that has to do with suctioning, anything like that, always assess the patient, listen to their lung sounds, get their vital signs down before you do the procedure. So when you're ready, you always check if they have an endotracheal tube in place. So you always want to check the placement of the tube, make sure it is in the appropriate area where it's supposed to be, and also check to make sure the cuff is inflated. So a lot of times there'll be a holder that can move back and forth, so this will help us in the oral care cleaning. So now we will connect our canister here. So this is our suctioning canister, so this will catch all of our secretions. So you're gonna go ahead and plug it into your suction, and you're gonna set your suction at -100 to -120 if it's an adult. And so when you're ready, after everything, so you're gonna go ahead and get your first thing you're gonna do is do a anchor. So this one, so you're gonna set this up. So you have a suction, and you're gonna make sure it's turned off, and you're gonna place your anchor on there, and then you're gonna attach it to your suction. So what you're gonna do is you're gonna turn it on, make sure it's working properly, and that it's gonna suction out all the secretions that you need to get out, or anything that may be in the patient's mouth. So when you're ready, is you're gonna pull back your protective sheath here, and then you're gonna turn it on, and you're gonna suction the side of the mouth, inside like the cheeks, by the cheeks, and then you're gonna go ahead and go towards the back of the mouth, because sometimes stuff can sit back there when they have for nowhere the secretions to go. So then you suction that, try not to initiate like the gag reflex. So when you're done using this, always turn it off, and then you always want to put the protective sheath back on. Then you're going to remove this and put it in a protective area. So the first thing that we need to do for oral care is we're going to do a suction swab. So this has a suction swab in it with some oral solution, and so then what you're going to do is connect it to your suction handle here, and you're going to leave off the suction. You don't need the suction on right away or anything when you're doing this. So you're going to take your sponge and you're going to go into your solution, and then you're going to go and clean on the side of the mouth, around the gums, and then you're going to do the tongue, and you're going to do the roof of the mouth. And then if you see any excess solution that may be floating in the mouth after doing that, then you can turn your suction catheter on, and then you can go ahead and clean out the mouth. And if you want to dispose that, and if you see any more, then you can take your yanker, and then you can go ahead and suction the rest of that out. And then after you do that solution, so you always want to put moisturizer onto the patient. So you're going to take your applicator swab, and you're going to take your moisturizer, and you're going to just squeeze it on kind of like toothpaste. And then what you're going to do is use this, since it's a clean thing, you're just going to spread it around your applicator like that. Then you're going to go ahead and moisturize the cheeks, because the mouth can get dry with them being on oxygen like that. You're going to make sure the roof, mouth, everything is nice and moisturized, and always get the lips. So when you have your endotracheal tube, so when this is in place, so if it has a holder, so you'll do one side and then you'll move this to the other side. Always make sure you get both sides and get the patient's lips. So then you dispose of that. So when you're doing oral care, you always want to come back every 2 hours to clean the patient's mouth, anything like that. So the next one you're going to do after 2 hours is a toothbrush. So this one has your anti-plaque solution. So you're going to take your suction, and you're going to go ahead and attach that to your toothbrush, and you're going to take your toothbrush and you're going to dip it into that solution. Make sure you're not having too much excess. You're going to go ahead and do a circular motion on the patient's teeth, not doing it too roughly, but just getting enough to make sure the patient's teeth are getting clean. Always get the back of the teeth, and make sure you get the everything like that. Just circular motion. When you're done, remove this and dispose of it. And then the next thing, always after you do cleaning, you always want to do another applicator swab with moisturizer. So you're going to put it on again, Then you're going to spread it around evenly around your applicator swab. And go ahead and moisturize the inside of the mouth, and then you're going to moisturize the patient's lips. And then after another 2 hours has passed, then you're going to go back, and the next one would be a suction catheter. So what you're going to do is take your suction catheter, and then you're going to go ahead and attach it to your suction handle here, and you're going to attach there. And always make sure you try to keep it as clean as you can with this. And then what you're going to do is you're going to turn on your suction, make sure it's working properly. And you're going to go ahead and suction out the patient's mouth, suction around the ET tube. That way it doesn't have any excess secretions building on it. And then always try to get the back above the cuff. That way that doesn't get any built up of secretions above that cuff. So when you're done with this, always dispose of it when you're done. And then you would always put your suction handle in a safe area. So this would be disposed of. So once you're all finished, everything is disposed of after doing an eTour care procedure, then you would always check after every cleaning. You would check the placement of your endotracheal tube, and then you would also check their vital signs, listen to the lungs, make sure their cuff is still inflated, and then you would go ahead and resituate them if they need anything. And then wash your hands, remove any PPE always, and chart in the patient's chart.